Good day, dear students. This is a video on regulation of serum osmolality. It is an introductory video, so it describes what is serum osmolality and what happens if there are small, slight changes, even 1% changes in the osmolality of the body fluids. Serum osmolality, as you all know, is the total solute concentration. The total concentration of all the solutes in the extracellular fluid divided by the total body water. So big terms, total solute concentration upon total body water, that is serum osmolarity. And osmolarity is expressed in liters, while liti is expressed in kg. So we are using osmolality because osmolarity can change with temperature. And as you can see, the term is 285 milliosmoles per kg H2O, around 300 milliosmoles per kg H2O, out of which 94% is by sodium and associated anions. Sodium and associated anions are the major contributors. They are chloride and bicarbonate. Then there are glucose and urea and plasma proteins. Glucose and urea contribute 4% and plasma proteins contribute the rest. For the sake of simplicity, whenever the physician measures the serum sodium concentration, you can multiply it by 2.1 and you get the serum osmolality. So if the serum sodium concentration is 142 milliequivalent per liter, then you multiply it by 2.1 and it is the serum osmolality is 285 milliosmoles per kg H2O. Perfect. This serum osmolarities can change. Even if 1% change is there, then that can result in swelling or shrinking of brain tissue, that can cause seizures, and that can ultimately cause death. Hence, if it is increased, say the solute concentration is increased, that is likely to happen when the total body water decreases. And at that time will happen in a desert-like setting. Desert-like setting meaning person is traveling in a desert with little water for a long time, or the person is deprived of water for a long time, or the person is running in a marathon and has taken less water than required. Once it changes by even 1%, a cascade of events is unleashed. You can see this runner running in a desert and with very little water, so he is deprived of water. And this increase in osmolality is sensed by osmometers, osmoreceptors in the anterior hypothalamus, which signal to the adjacent posterior pituitary gland to release ADH, anti-diuretic hormone. What is ADH? Anti-diuretic hormone. Means in its absence diuresis occurs, means water loss occurs. So it prevents water loss. So ADH will increase the reabsorption of water from the late distal tubule and the collecting duct, and thereby restore the osmolality back towards normal. It does this by inserting motor channels called aquaporins into the late distal tubule, into the principal cells of the late distal tubule and the collecting duct, and reabsorbs water, and that is how we restore the balance. Balance meaning normal serum osmolality is brought back to normal. There is normalcy. But if the total solute concentration remains the same and person drinks a large amount of water, then again the serum osmolality decreases. If he is deprived of water, then it increases. If he drinks say 1 liter of water, then it decreases. As for example, in a party with alcohol, and that is again sensed by the body with 1% changes sense, because if it if the osmolarity increases or decreases by 1%, then that can result in shrinkage or swelling of brain tissue, and that can immediately cause convulsions, coma, and death. Directed by osmoreceptors, these are also called osmometers in the anterior hypothalamus, and they put a brake on the release of ADH. And as a result, there is little or no water reabsorption from the late distal tubule and the collecting duct, and the osmolarity is brought back towards normal. So, this is a simple mechanism. The total solute osmolarity is the total solute concentration upon total body water. It is 285 milliosmoles per kg H2O. 94% is by sodium and associated anions, 2 into sodium concentration. If it increases, it is sensed by the hypothalamus. It signals to the posterior pituitary to release ADH. ADH increases the insertion of water channels in the principal cells of the late distal tubules and the collecting duct, and increases water reabsorption. But if it decreases when a person drinks a large amount of water, then ADH decreases and no water is reabsorbed, and that is how serum osmolarity is restored. Thank you for watching my channel. Have a good day and enjoy the day.